Hello, beautiful souls, and welcome to another episode of the Indigo Wound Wisdom Podcast. I'm your host and sister friend, Shatia T. Owsley, and thank you for watching and or listening. So sit back, grab some tea and a notebook, and let's vibe together as we have organic and practical conversations embracing intuitive womb wisdom, spirituality, and a sprinkle of magic to rebel, restore, and radiate overall wellness in our lives.
Hello, everyone, and welcome back to another episode of the Indigo Wound Wisdom Podcast. I am your host and your sister friend, Shatia T. Owsley. And today I would like to introduce our guest, Dr. Lee Matthews Carter. Hey, Dr. Lee.
Hey, y'all.
Dr. Lee Matthews Carter is a licensed pelvic floor physical therapist, a birth coach, and a certified perinatal yoga instructor specializing in pregnancy, birth preparation, and postpartum recovery. With a doctorate in physical therapy and a background in kinesiology, she combines clinical expertise with a holistic approach to empower women through every stage of motherhood. Dr. Lee is the founder of Mama Stay Wellness, where she offers individualized care and evidence-based strategies to help women reduce pain, prevent injury, and to feel strong and confident throughout their pregnancy and birth experience. She developed the Birth Ready Method, which is a 6-week program that blends pelvic floor therapy, birth coaching, and movement-based practices to prepare clients physically, mentally, and emotionally for labor and recovery. Drawing from her years of experience supporting clients in clinical settings, private practice, and community workshops, she is passionate about filling the gaps in prenatal care, especially when it comes to pelvic health, labor preparation, and healing after birth. Her work centers on education, empowerment, and eliminating the wish I had known moments so many new parents face. When she's not working with clients, she's creating online education, teaching prenatal or mom and baby yoga, and advocating for better maternal health support. Dr. Lily, I'm so happy that I slid in your DMs and you responded to me.
Yes, ma'am. That intro was great. Isn't ChatGPT the bomb?
Girl, come on now. I am so happy to have you here today. I know I read some of your bio, and I love to read people's professional bio because I want people to get the professional side of you, right? But what I like to do is I like for people to also get a foundation of who you are just as a person. Who is Dr. Lily? Give us all the deets, and then we'll get into the nitty-gritty of all the amazing work that you're doing.
Okay. To be called a professional is hilarious to me because I feel like I'm an overgrown teenager. I'm like, how am I supervising people? How are we the new adults? This is hilarious to me.
Yes.
But I would say my journey in physical therapy, I first, stumbled upon it when I was about 6 years old. My dad was in a really bad work accident where he broke both of his ankles. And at the time they were saying he's never going to walk again, all this. And my dad, he was a college athlete. He played basketball in college. And he's like, I'm going to walk again. I'm going to do whatever I need to do to walk again. So I was a really good kid. I got to go with him to his physical therapy appointment. So that was my first introduction to it. And I got to see him because he was like non-weight bearing. So he was like doing pull workouts to him barely being able to ride the stationary bike. And I got to see him run on the treadmill. So that kind of like sparked the like, oh, like my life would have been so different if my dad wouldn't been able to walk the rest of my life, if he would have been wheelchair bound, not able to work. So that kind of like sparked my interest. And then going through high school, I was kind of thinking, what I want to do. And I knew I didn't want to sit all day. I said, I need to do something where I'm active. I like to exercise. I went to college on a tennis scholarship. So I've always been super athletic, used to cheer, run track, do all the things. And I think through that, because I've had my fair share of injuries, when people would have a sprained ankle or whatever going on, they'd be like, okay, well, Lee, what'd you do to rehab yourself? So I was kind of treating people before I was like even in the professional field. I went to college for exercise science, pre-physical therapy. I was pre-med for like 2 seconds. I took chemistry. And then I saw with the pre-med, you had to make it organic. I said, I didn't understand it well when it was regular. Now I got to make the chemistry organic. Put me back in pre-PT because that was a requirement to get to the school. Right. So I did. I went to physical therapy school at Hampton University, HBCU. Graduated in 2016. Started in outpatient therapy. I thought I was going to do more sports because that's my background. And then I got into it and I was like, I don't know. It's more so the parents and the coaches than the kids, of just them trying to push them to play before they're ready and just being caught in between that and the athletic director. And I was like, I didn't know I was signing up for all this. And at the time they had an opening for pelvic floor therapy and I knew about it. But when you're in PT school, it's not like a major part of the test. We literally, for one day, a pelvic floor therapist comes in, she does her presentation, says what she does, how she treats people, what she treats, and then we kind of never talk about it again. So once you graduate, it's on us. Like we have to have like continuing education credits and stuff like that. So it's up to us to seek out those courses, which are, none of mine were paid. These are expensive courses. Sometimes if the job is desperate enough, they'll pay for you and stuff like that. But a lot of times they're not even in your state. Like I went up to New York for pelvic floor 1. I went to Michigan for pelvic floor 2. I went to Columbus, which is like an hour and a half away from me, for other courses and things like that. Some online courses during the pandemic because a lot of things were online, so that was more accessible. But when I went to shadow the pelvic floor therapist at my job, I'm like, I don't know this. But just to hear women talk about, I've had incontinence since I gave birth. And after 5-6 sessions, I can jump on a trampoline with my kids. I can pick my son up without leaking. I can go to the gym and work out without thinking, do I need to bring an extra pair of clothes? And I'm like, what? In 5 or 6 sessions, you've had this for 20 years. They're like, yeah. And I'm like, I like those odds because a lot of times you have people, we'll have people that got 50 years of back pain. They talk about some fix me in 12 visits. I don't know. A lot of them, they done had motorcycle accidents, 15 car accidents, done fell off a roof, like all this stuff. Like their back is, I don't know, like they probably need surgery. They probably passed physical therapy. But to know, like in that quick turnaround to change someone's life, to give them back that agency to be like, I can go to the gym again. I can play with my kids again. I can go out and have a drink with my friends and not think, am I going to leak here? And then I was learning that a lot of these injuries, a lot of people said this happened right after I gave birth, or they had a delivery when they had forceps or vacuum or something like that, or they had a episiotomy. And I'm like, so you're telling me if there was a way I could get to y'all before birth, that some of this could have been prevented? They're like, yeah. I'm like, okay, well, I'm about to go back to school. So let me think about this. And around the same time I was doing yoga, and the yoga studio was teaching, they had a prenatal yoga certification. And it was really for people like already that were yoga teachers. But I was like, I just want to learn things to help my clients out. And it turns out it was for yoga teachers. I had to do a whole practical, but I did well. And they were like, you should go on to do the 200 hours so you can teach other forms of yoga. So I did that. I done lost my train of thought in my story. I'm going to get to it. I have ADHD, y'all. Diagnosed on my neurodivergence. I feel you. I see you. I'm with you. I'm one with you.
Yeah.
Oh, so when I was teaching prenatal yoga, there we go. One of the girls asked me, could I be her birth doula? And I didn't know what it was. That was the first time I heard of it. And I was like, what is that? And she's like, well, you would be my birth coach. You would basically go over comfort measures, non-medical ways to cope with the pain, prep for birth, help me with my birth plan. And I'm like, at the time I didn't have kids. So I'm like, I don't know anything about this. And I'm a person, I'm not going to charge you for something unless I done did the knowledge. So I was like, I think I'm interested in this. Let me see about it. And was on, I think Facebook Here's Your Thoughts. Cause I'm like, I don't think I searched that at that time. And I'm seeing all these ads about birth doula trainings and stuff. And this girl had a podcast. What is it called? I told you my dog, he's on something. Birth doula podcast or something like that. Or doula road trip, I think it was. And she's in Cleveland, which is about 3.5 hours north of me. And they were having a doula workshop there. So I said, okay, I'm going to do that. And so kind of stumbled upon that. And then a couple months after that, I had my son. And so I saw a couple births and I was like, I ain't going to do this no more. And then saw a couple births. And so now I call myself a birth coach because being on call with a 2-year-old is a lot. But I still want to spread the knowledge that I have because I'm like, that's not fair to people to not get the knowledge that I have. That's where I came up with the Birth Ready program because I'm like, I'm really in a unique spot because a lot of people have to go see 3 different people. They would have to have a birth doula, a prenatal yoga instructor, and a pelvic floor physical therapist. And I'm like, well, I can do all that. Like, boom, let's just do it all here with me. So that's my story.
Yeah, I love it. So how did you decide? Well, I understand how you decided because there were so many synchronicities that happened that paved the way for you So when you're working with clients, with you being able to be in 3 different roles, as you mentioned, I'm assuming you integrate all of that together, but do people come to you just for one or the other, or is it a package and we just gonna work on everything together? How does that work?
So before I had my own practice, I've been teaching prenatal yoga since 2017.
Okay.
And so I did the birth doula stuff. What was that? In 22. But even before then, I was picking up knowledge and stuff like that. Because even my prenatal yoga certification, every class starts off with us doing a group conversation on some type of topic. So I had some childbirth education just to get that certification. And then I learned a little bit more when I did my doula certification. So I'm a person, if I know something, especially if I know something that can prevent you from having a bad birth experience, I'm going to tell you. So the classes have definitely evolved with the more knowledge that I've acquired. I tell people it's prenatal yoga, but then depending on what kind of session I had or somebody had a question or something like that, or somebody will bring up something in class, I'm like, okay, well, let's unpack this. Let's talk about fear and birth and how that can impact your birth. Let's talk about the stages of birth. Or I'll ask them, has anybody talked to y'all about what exercises y'all should be doing? How often y'all should be exercising? What about your nutrition? Has anybody talked about that? How to prevent preeclampsia is just eating more protein. A lot of people don't know that. And like their doctor doesn't tell them. So I tell people I kind of word vomit. So I'm just like, somebody will say something. I'll say, oh, well, that reminds me of this. And that reminds me of that. And that reminds me of this. And I'm not going to lie. Sometimes we don't get to the yoga, but they're appreciative of it. Right. Because they're like, I wouldn't have got this information anywhere else. And they would have been on Google searching for hours trying to find the answers to these questions, or they don't even know or have the language to have the question in the first place. Because you go to the doctor and say, any questions? Well, you don't know what you don't know. Right. So a lot of times those conversations spark them to go in and then ask their doctor, well, how do you feel about this? Or I think I want to have this type of birth. Or if this happens, what's your policy on this? So it ends up being everything. And then, of course, I integrate pelvic floor in my yoga stuff, too. So I'm like, okay, we're going to learn how to relax this pelvic floor because we don't need no tension in this pelvic floor when this baby come out. The uterus does all the contracting. Pelvic floor needs to get out the way. So let's work on some breathing techniques, some calming techniques. So it kind of gets all integrated in my yoga class. And then if somebody tells me, oh, yeah, by the way, last time I sneezed, I leaked on myself. I'm like, you need to come see me one-on-one. So then it ends up being that. And a lot of my pelvic floor sessions integrate a lot of yoga and Pilates type of moves of how I do my rehab techniques. So it's all blended. I can't just turn off one. Yeah. I know I like showed up for one thing, but I'm like, if something sparks my interest, I'm not going to be like, well, I ain't going to talk about that because that ain't what I'm here for. Right, I'm going to answer the question.
Right. And for those who may be new to hearing pelvic floor therapy or what a pelvic floor therapist is, especially with you stating that when you went to PT school, this wasn't its own separate course that you took, or it wasn't a, 6-week internship that you did in this particular, in pelvic floor therapy. Can you explain what a pelvic floor therapist does and what could a initial pelvic floor consultation look like for someone coming in? But just giving a little bit of foundation for those who may not know what pelvic floor therapy is.
Can I grab my models real quick?
Yes, you can.
Yes. I'll be right back, y'all.
Okay.
I got to show y'all. I can show you better than I can tell you.
Okay. We love to see models because I think when you're able to see models and you're able to see pictures, it sticks with you a little bit more than someone just talking about it. So the fact that Dr. Lily is going to take some time to give us a little mini class, I'm here for it.
Yes, because it's hard to talk about something that most people don't even know exists.
Correct.
So it's like if we were talking about knee pain, you see your knee every day, right. You know that it bends and that it straightens. You know that your thigh is connected to it and you got your shin bone. Like there's not a lot to explain. But when you say pelvic floor, they're like, what is it? Where is it? So I'm like, it's better if I can show you than to tell you, because even me telling you, you're like, I don't have any reference point to what that even looks like.
Right.
So these are my pelvic models. This is a vagina. So your pelvic floor is this bowl of muscles right here. So if I didn't have this space here, what would sit here is like your anus, the large part of your intestines, your colon, your bladder, and your uterus. That's all packed up in here. I should have got I got the little organs that sit up in here too, and I was just going to take them out. But that's what's all packed up in here. So your pelvic floor, it has a couple of functions. So, of course, babies come out of here. So it's for birthing. Of course, intercourse, you can make the babies. Your bowel and bladder functions, controlling of that. and then a little bit of stabilization because these bones need to be held together by something. But what's supposed to happen is that your back muscles, your glutes, your hips, your core is supposed to really stabilize these bones. But when those muscles are weak, that's when your pelvic floor starts to do a little bit too much. So a lot of us have an overactive pelvic floor because it's compensating for what these muscles can't do than a weak pelvic floor. But people think it's weak because something's going on with it. They're having pain with intercourse. They're having incontinence. What else? They have prolapse. They're like, oh, I have a weak pelvic floor. And it's like, well, not necessarily. I kind of say these muscles got to function like a trampoline. Like the trampoline can't be too tight because then you can't jump on it. You can't have like this spring action. It also can't be too loose because then you also still can't jump on a trampoline because it doesn't have enough spring. You have to have that right amount of tension for it to actually work the way it's supposed to. And our pelvic floor is the same way. Now you wanted to know an exam. Okay. So exam wise, I go from head to toe because I tell people, you know, that song that the elbow connected to the wrist bone and the knee. It's all, I went down to somebody's flat feet to be like, because of your feet done got flat. I traced it up the chain. Now your hip drop and that done messed up your pelvic floor. Now your head hurt. And that's what's going on.
Exactly.
So I connected all. So I'm very thorough. And that's another reason why I got out of the clinic, because in outpatient world, if you have the diagnosis of hip pain, I'm really only supposed to look at your hip.
Okay.
You don't work that way. It could be something going on with your knee or your ankle or your back that's influencing why the hip moves the way it does. So when I have my own clinic, I make my own rules and I do my own thing and I look at all the things. So I look at range of motion, back range of motion, hip range of motion, test out their strength, things like that, to see if these muscles are firing to support these muscles like they should. And then if it's okay with them, I don't have to, but it gives me more information if I can. I ask, can I do an internal exam?
Okay.
So what that looks like is I look on the outside layer to just see if there's like any scar tissue, if they had like a 4th degree tear, episiotomy. Your clitoris here, a lot of times I see people that they have decrease in arousal or orgasm. So they said, my orgasms were better before birth, and now they're not so great. What's going on? A lot of times scar tissue can be preventing these tissues from moving like they should. Your clitoral hood, you have like a hood over there. It's supposed to be able to move about. So if that's stuck or not moving like it's supposed to, it's hard to get aroused. So what I do is I just take a look at everything. And also I want to make sure, can you feel me even touching you? Can you feel me touching you? What's going on? And then I'll separate the vaginal lips and I'll say, cough for me. I want to see, are those muscles going out toward me or are they going in? They're supposed to support you and go in instead of out.
Okay.
I'll say, push down for me. I'm seeing if anything is coming out toward me. That's a prolapse where like the wall between like your uterus, your bladder, your anus, that may be going into the vaginal canal and I could be seeing that. I want to see how they do a Kegel. A lot of times people are just squeezing their butt muscles, but they're not actually squeezing here. So I'm like, let me see you do a Kegel. And if they can't do it, I'll say, okay, I'll give them a couple of verbal cues. Can you try to nod your clitoris toward your anus? So go like that. Can you pretend like you're picking up a blueberry with your vagina? So I'll try to give different analogies and things that get them to trigger those muscles. And then, so this is the first layer. If I take this off, there's like a fascia layer that you can't really see, but there's like fascia here. And then this is the third layer. We have like these deep muscles in here. So that's why a lot of times people will have back or hip pain, not knowing that it's pelvic floor issues, because right here in this space would be your piriformis, which is like a muscle in your butt. So if this is tight, that's going to make this tight, which can cause tailbone pain if these muscles are tight. So it's all connected. But the internal exam is really quick. It's not like when you go to the OBGYN and do a pap smear and they got the specula, all that. We ain't doing all that. So I put gloves on, I lube up my finger, I put my finger in here, and just like to this right here.
Okay.
And I'll say, can you squeeze around my finger? I'm saying, can you squeeze all the way around evenly? I want to see if that hurts to squeeze. And then I'll palpate. We know the muscles by a clock. I'll palpate around and say, does anything feel tender? Does anything hurt? Because just like we get knots in our shoulders and things, you can get tension and knots in your pelvic floor, and that could be pain with sex. A lot of times people don't know, well, it kind of hurts on the left. I could just put my finger right here, tell them to breathe 5 times and relax. And I don't relax that muscle. Now they don't have any pain anymore in one session. Now, of course, it may come back if we don't address the issues why it became tight in the first place.
Okay.
But a lot of times it's just people needing that internal work. So then I put my finger a little bit deeper because I need to get back here to all these muscles back here and see how these muscles are doing. So I'll say, do what you think is a Kegel. And I'm looking to see, can I feel them squeeze from the front, middle, and back? Am I getting an equal squeezing of the muscles? And then I also go around and say, does anything feel tender or sensitive or tight? Any pain with that? Okay. And then I want them to try to push my finger out. So I'm also checking for prolapse that way. If something's coming from the top, I know what that is. If something coming from the bottom, I know what that is. Then I want to know how long can they hold that Kegel for? I want to know the endurance of these muscles. So when you're like at the grocery store and you're like, I have to pee, you got to have good endurance because you may not be able to get to the restroom or the restroom out of order. So we got to have good endurance. So I'll say, how long can you squeeze my finger for before that muscle starts to release? So then I'll count that. So say the number 6. I'll say, how many times in a row can you do that? So we'll do count for 6, relax, count for 6, relax. Okay, got that number. And then I want to know fast twitch. So that's when you cough, you sneeze, you jump, where these muscles have to quickly go boom to support you so that you're not leaking. So I want to know, can you quickly contract, relax, contract, relax? So I want to see how many times you can do that. So, and that's all based on a strength scale. If you can just squeeze my finger evenly, that's a 4. If you can squeeze it and pull my finger in, that is a 5. If you got a 5, you probably don't need me.
Okay.
But most people that I'm seeing, they have
you,
3s and 2s. It's not as much of a squeeze that you have, or they're not coordinating the muscles right and all of that. What would you about
I
to
was going to ask you too, what was the scale? Was it 1 to 5 or was it 1 to 10? But you just answered.
Yes,
you were saying
it's
5.
0 to 5. So I feel nothing at all.
Okay.
That's 0. If I feel like a little bit of a flicker, I'm like, I think I felt something, or just like one side kind of squeezed, but the other side didn't. That's like a 1. A 2 is a little bit more. 3 is, I feel it squeezing, but it's not holding my finger. I could easily just slip my finger out. A 4 is, this has a good grip on my finger. A 5 is, you can grip my finger and pull my finger in. That's a 5.
Okay.
And it's all even and everything like that. There's no pain with it, no tension. What else I look at? Also, a lot of people just do it laying down. They'll do the exam laying down. Well, we don't live our lives laying down. So I said, I need you to stand up for me. Because now we got gravity in the way.
Okay.
Can you squeeze my finger the same pressure that you did laying down? A lot of times they can't. And that's when they're having their problems, when they're sitting, when they're standing. So I say, okay, when you're laying down, you're doing great. And they probably will tell you, yeah, they don't have any accidents when they're laying in bed or anything like that. If they were watching TV laying in bed, they have no problems with that. But when they're sitting, talking with friends, and they're laughing, they're having problems. When they're trying to run, they're having problems. So I say, okay, we need to strengthen these muscles in these sitting and standing positions to get this all together. And then at home, I got my wand. So, of course, I don't want to be in people's cooch all the time.
Right.
So they can buy these wands.
Okay.
And so if they have, and I tell people to do a perinatal massage for my prenatal population. So a lot of times it's hard for you to reach up in there by yourself. So I got these wands. You got a narrow end, you got this end, and you can go in here and say you had some tension over here. And then I can teach you the breathing techniques to count to 5, release, relax, and you can go around to the different muscles that are tight to do your own releases at home.
Okay. Dr. Lee, I have so many questions over here that I'm writing on my little sticky notes. This is like a class, and I'm hoping that when people watch that they will be better informed, well informed, and seek out their own pelvic floor or reach out to you because I don't think this is talked about enough. I think when you're in the birth world, you may hear it a little bit more than people who are not in the birth world. You know, but it's still fairly new. That's usually not one of the people that are on your care team is a pelvic floor specialist. And even when you go to the doctor, not many doctors are referring you to a pelvic floor specialist. Even if you go to PT, they're not saying, well, let's see if your back pain, your hip pain, you know, the joint pain that you're experiencing is any way associated with your pelvic floor. And let's get you in to see a pelvic floor specialist. Even if it's just to say, let's just rule it out. And then we can kind of circle back and figure out what's going on, which is, again, why it's so important for a team approach. And like you said, a holistic approach to wellness, because everything is all connected. And you explained it perfectly when you talked about the leg. your thigh can't do nothing without your knee, what your knee can't do without your shin and your ankle. And, so it's the same thing for your reproductive health as well. So I wanted to go back a little bit, and if you could give us a definition of what fascia is, because some people may not know what fascia is and what its purpose is and why it's so important.
Fascia. It's like this Saran wrap around your muscles.
Okay.
That's like the best way I can explain it. But you have like these Saran wrap connections. So if you ever seen like the muscle man people, and it's like that white stuff, like the red, pinkish is the muscle, and that white stuff in between that holds muscles and things together, that white stuff, that's fascia. So that's how you can contract your core muscles, but feel it in your back, because even though that's not a one muscle, you have a fascial connection. This Saran wrap is connecting these two muscles together. So a lot of times if the fascia can't move, your body can't move because your muscles are attached to that.
Okay.
Hope that was a good way to explain
it. Yes. Can fascia be damaged? And if so, how is fascia damaged when it comes to pelvic floor?
It can definitely be damaged. And that's another thing. Massage therapy is also super important.
Okay.
A lot of times, because that's not medically, it's not covered by insurance. A lot of times, like if you have a medical massage, they'll give you like a few dollars off or something, but it's not covered. But I'm like, they're so important because they help restore how the fascia moves, that massage, and even like your lymphatic system, like they help restore all of that. Where PT back in the day, like we used to be the massage therapist, the physical therapist, all the stuff. Now it's like, we went over like a week, had a practical on it because it's a profession all on its own. But we do some hands-on stuff too. So we know a little bit, but that's their whole profession. You said, can it be damaged? Yes. So a lot of times, I think they said like 90% of people will have some sort of vaginal tears with pregnant or vaginal births. So a first degree tear, I kind of say that's like a paper clip. You don't need any stitches for that. You're not going to have fascial damage because of that.
Okay.
2, it gets into the muscle a little bit. You have a few stitches. So people say, oh, I had 1, 2, they probably had a second degree tear. Okay. 3, that's going a little bit. 4, you cut from the front to the back.
Okay.
So you've messed up the muscle plus the fascia, all of that. So you have scar tissue that needs to be worked on. And that's another reason why the internal worker using that wand can help to break up that scar tissue. Even with C-section scars, a lot of times people say, well, my scar doesn't lay flat, or they got like this shelf, like their fat kind of goes over the scar, because we need to break up that scar tissue so that their fascia and the muscles and everything can work properly and be able to fire correctly and all of that. So the same way that C-section scar cannot lay correctly, the same thing can happen with your stitches inside.
And then when doing the massage, you said you help your clients learn how to do the massage with the wand or with their hands. And what does that look like?
What does it look like how I teach them?
Yeah, like
I'm more so with the models. I'm not like, hey, look at me. So if someone has, like I had a client recently, she had a second degree tear. She had a couple of stitches. And when her and her husband tried to be intimate, she was like, I'm having some pain. So I did her exam. She had some tension on the left. So I had her breathe and everything. I did some, they call it like deep tissue. Well, I guess you would call it deep tissue massage in there, but I'm basically just holding it to that muscle releases. And so I tell her, I'm going to give you this wand. Do you feel where I'm poking right now? I want you to work on this. And I want you to just, not even this spot, but other spots around there. Because even though this may be your tightest spot, everything's connected. You probably have a little bit of tension along the whole pelvic floor. So go around like a clock and hit all those spots and breathe through them. If it hurts too much, back off. If you're like, I can do a little bit more pressure, do that. You can do even like a pressure point, like a pull away. So it's kind of like a press, pull as you go around like this clock. So I just basically explain it that way. And then with my models, I kind of explain to them that way too. And when I do evaluations, I let people see their evaluations. I think it's really weird that you got to pay to get your own medical record. I'm like, I'll just send it to you because like it's about you. You should know about you. And if you go to talk to your doctor about it, you'll have the language to speak to them about it too. So on their evaluation, I have a picture of a pelvic floor and I will circle this muscle back here was tighter. This muscle here was tight. So they can have that language to talk to their doctor too.
And so you have brought up breath work. Those who do meditation, those who do yoga are familiar with, to some degree, breath work. But I don't think people really truly understand the importance of breath work and breathing correctly, just on a day-to-day basis. And with so much stuff going on in the world, you truly have to be intentional about your breath and your breathing, because a lot of times we're holding our breath or our breath is so shallow. So when you're integrating breath work into pelvic floor work, it's two different jobs that you have. Okay, we have to get you to breathe correctly, right? And we're also trying to heal your pelvic floor. And we have to do this together because they work together. And what you're able to do with your healing really is contingent upon how you're working the two together. So what is the importance of breath work? How does breath work play such a huge role in the healing process or working through the exercises in pelvic floor therapy?
So your diaphragm and your pelvic floor have a very intimate relationship. They best friends. So what happens though, your diaphragm, underneath your lungs, your rib cage, you got your diaphragm here. And people that have had like professional singing lessons, they know how to control their voice and use their diaphragm. So if they be like, oh, I'm a singer, I'm like, yes, you're going to get it. So as you inhale, everything goes up. As you inhale, everything goes down. So you fill your belly up with air, everything goes down. As you exhale, everything comes up. So a lot of people, their doctor just says, go home and do Kegels. They're doing Kegels on the inhale, not even knowing they're like fighting their own body. They're like doing this and causing more pressure on their pelvic floor instead of everything being one. And even with that, your ribs are supposed to expand 360. So your ribs are supposed to go out this way on the sides and the back as you're breathing. So as you inhale, belly expands, ribs expand, everything drops down. As you exhale, everything comes up. If you can't get this part work, and I've spent 2 or 3 sessions just getting this part right, because I'm like, it builds on everything we do, because all the exercises, you can't hold your breath and do the exercises because then you're putting more pressure on your pelvic floor. And a lot of people, that's what they experience, the prolapse, or they have hemorrhoids, things like that. They're holding their breath and picking up stuff and not exhaling, because when you exhale, everything naturally lifts. So they say, like, when you do the hard part of an exercise, exhale, because you're naturally lifting everything, which is decreasing that pressure on your pelvic floor. Okay. So just breathing in general, yeah, of course. Now, if I'm just sitting here, like, I'm not doing super big belly breaths and rib breaths and things like that. But in general, people should just sit down, breathe, bring some oxygen to your muscles. Take a minute and just really breathe.
Yeah.
A lot of people out here not even getting the oxygen that they need because they just sitting here breathing shallow. So, especially when any exercise, and that's another thing that gets on my nerves. You got all these people that want to be personal trainers, and they just people that lost weight. And it's like, you don't have no training other than you know how to lose weight, you know how to work out. But far as training other people, you could be making their symptoms worse because you're not getting that breath work. You're not paying attention to people holding their breath, or they're inhaling on the wrong part, or all that stuff, or they're grunting and all that stuff. Like, we're not having a baby here. We just exercise. Why are we doing this? So the breath work is so important, because if we got the breath wrong, scratch the exercises, because you could be making yourself worse because you're not breathing correctly with the exercises.
Okay. So just like a really quick, what is one breath exercise that people can do, whether it's for pelvic floor health or not, just one breath exercise where people can just be intentional to take 5 minutes out of their day just to be present? What would that look like coming from Dr. Lily?
4-6 breath, super easy. So I tell people, put your hand over your chest, put your hand over your belly. We're going to inhale for a count of 4 and exhale for a count of 6. We're going to do this all through our nose. As you inhale, your belly should fill up with air. As you exhale, belly should come down. You shouldn't get too much in here. So we're directing everything downward. And this is also a pelvic floor relaxation exercise. If you're sitting on something, you can get that external feedback that as you inhale, you'll feel your pelvic floor slowly lower down into the surface that you're sitting on. And then as you exhale, it will gradually lift up. So here we go. I'll count you all through. You can close your eyes too, so you can envision all this stuff going on in your body. All right. So here we go. So inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. So that's just a simple breath people can do. A lot of times I'll introduce that breath And then I'll say, y'all keep breathing that way. And I'll talk to them. So I'll say, scan your body from the crown of your head to the tips of your toes. Release any muscle tension that you're feeling. A lot of times we walking around like this, not even realizing it. It's like, okay, let's relax everything. As you inhale, think release. As you exhale, think relax. And just kind of settle into this calmness. Go ahead.
This feels like it's some core workout too.
Yeah.
Yes. So I was like, ooh, these muscles in the stomach are getting activated. So yes, I love that. So another question that I had is, when you are working with clients, how often do you see trauma show up in the pelvic floor space?
So I don't specifically ask them like, hey, when you were a kid, did something bad happen, anything like that? But a lot of times it's birth trauma that I'm seeing. A lot of people have anxiety, and that can cause a lot of pelvic floor issues. And you can kind of tell when people are a little high strung, you can just kind of tell because they probably have a really tight pelvic floor that we got to release.
Okay.
It will come out. A lot of times people will tell me traumatic things that they have gone through, and that makes a ton of sense. And I tell them, I am just a physical therapist. I am not a mental therapist. The good thing is, where my office is located now, around the corner, I'm upstairs from a yoga studio. So upstairs there, I have a massage therapist. So if they need a massage, I can refer to her. And we also have a mental health therapist.
Okay.
So I'm like, hey, you don't have to go to her, but since you already are used to this location, I can refer to her, or just anybody. I tell people you can do Headspace, BetterHelp, Talkiatry. There's so many resources that you can get stuff online that takes your insurance too. So a lot of times they have to deal with that part.
Okay.
Just to relax, because we can do all the stretching and breathe and all of that. But if your mental is still holding on to that, you're still going to hold on to that trauma. You're still going to have that tightness. So a lot of times I have people seeing 3, 4, 5 people. I'm like, okay, you need a massage therapist because your muscles are tight. You need to go see mental health therapy. Sometimes I even refer them to a chiropractor sometimes. So, and their OBGYN, their midwife, they're on board. They know what's going on. So I tell people I went to school for one thing. I don't want to be all the things, because I used to be, I'm gonna be a lactation consultant. I'm gonna do this. And why? I know people that do these things. I have a friend that's a IBCLC lactation consultant. So if they got breastfeeding issues, just go to her. I don't have to learn all that. So I definitely tell people, even though you're seeing me, I may have you go see somebody else, because I don't have all the answers for you. And I'll be doing a disservice trying to act like I'm your therapist, because I didn't go to school for that, and they know how to get you out of that and ask the right questions and everything too. So even though I've had people, anxiety in birth, like if I had a client that had like 4 or 5 miscarriages before she was successfully pregnant, and the whole pregnancy, she just kept thinking, I'm going to miscarry tomorrow. And I'm like, you cannot go through your pregnancy like this. I'm like, because when we get to labor and delivery, because she had to have a D&C, the last time you were in a hospital, you were having a miscarriage. So I don't need you to correlate that and have that going through your mind. Like, we're celebrating your baby's birthday. We're supposed to be having a joyous experience. It's not supposed to be traumatic. So to prevent this from being traumatic, another traumatic experience for you, you're going to have to unpack that. So, and if they don't listen, I talk to their spouse, their partner, their mama, their daddy. I'm like, they need therapy. They're not going to do well. They need therapy.
Yeah. How soon after birth should someone come to see you?
After their clearance. So 6 weeks typically after a vaginal birth, 8 weeks after C-section. But they can always talk to me. I tell people, even though 6 weeks is like the clearance for internal work, if they're having any type of back pain, or I could still give them some breathing stuff, some light stretches to do that's not too strenuous, that can help them along. We're not going to get into the real program until they're cleared, but I can always help people if they're having issues before then.
So let's get into your program, Dr. Lee. Let's talk about the birth readiness program and what the program is all about. And for clients coming in, what could they expect working with you in this program?
So the Birth Ready program was kind of developed from, I would have these yoga students and they would have doulas, but like, since doulas is not like a certified thing, they're all different. Like, they could be people that actually went to trainings, different trainings, or no training at all, and they just call themselves a doula. And so I would feel bad that I wouldn't cover certain things thinking that their doula was going to do it. And then they would say, well, I didn't know this and I didn't know that. And I'm like, oh, I could have definitely changed your birth experience if I would have knew that your doula wasn't going to go over those things. Because then I could have went over it. So that's how my yoga class has just evolved to let me tell you all the things, because I don't know if you're going to get this information.
Right.
What you'll get is basically pelvic floor physical therapy. I tell people, if you're pregnant, you should be going to a pelvic floor therapist, because not at one visit are they going to teach you how to push. Not one visit. They're going to wait till they're going to say, yep, you're ready. Hold your breath for 10 seconds. Be on your back, push. And it's like, there's better ways to do this now. We can push in different positions. There's different, you don't have to hold your breath. You can hold your breath for a little bit, breathe a little bit. Like there's so many different ways to breathe that no one teaches them. And some doulas, like in my doula class, we weren't specifically taught how to coach someone through breathing. It was more, this is how you squeeze somebody's hips. These are the birthing positions they can do. But as far as like how to actually push, that wasn't really taught. But I know it's a fine line because doulas aren't medical professionals type of thing. But with my pelvic floor knowledge and just taking different CEUs, like this needs to be brought up. So a lot of people just think I'm going to just show up to the hospital and have a baby. And I'm like, that's so crazy, because there's no event in your life that you do that. You don't just say, I'm going to just show up to the church and get married. No, you have a whole plan. Unless somebody is like doing a surprise birthday party for you, you know how you want your birthday to be. You have a whole wedding planner. You have a whole event planner. You got people that's catering your food. You got you got all this stuff. But yet when we get to birth, we just say we're going to let them handle it. But it's your experience, though. That's really weird. So with the Birth Ready program, I tell everybody I should be doing pelvic floor therapy, because a lot of people don't know how to relax their pelvic floor, even though that it's tight. So if people are already having pain with intercourse, incontinence, they're going to rip. They're going to tear when they give birth, because they already have a too tight pelvic floor that doesn't know how to relax to give birth. So we're going to work on that stuff. I have their partners come in, because I say, hey, every contraction, you having it with her. You need to be putting a towel on her head, washcloth on her head, squeezing her hips, massaging her shoulders. Like I tell them, I even give them a little workout. You need to work on your chest muscles, because you're going to be doing this a lot. You're going to be doing this, pushing on their back and all of this stuff a lot. So I even give the partners some exercises, because I'm like, this could be 15, 18 hours long of us supporting this person. So they'll get the pelvic floor therapy, which is a mixture of the education plus the yoga plus the Pilates of the treatment. And I'll have their partner come in. Sometimes I'll do partner yoga, prenatal partner yoga, so I can teach all the comfort measures and stuff with just like a huge group to have everybody there at once. But they'll get the education, the pelvic floor, the yoga, all the stuff all in one. Like I said, typically people have to go to 3 different people. They're getting all that in one setting, because I was thinking people were getting the knowledge and they weren't. So I'm like, let me add this on. But what really, I found out people in Canada was doing this. They were like, yeah, we're doing these birth ready or birth packages with our pelvic floor. And I'm like, oh, y'all like are selling that? And I just be telling people stuff for free. I didn't know I should charge for that. I was just
making my community better.
Right. They're like, no, that's like an extra service. You should definitely charge for that. I was like, okay. So that's kind of how it came about too, because I was already kind of doing it. I just didn't have a name for it.
Right.
And then I was like, oh, let me package this up and present it, because I'm offering something that people wouldn't necessarily get at even another pelvic floor therapist, because I'm specifically prenatal postnatal. Some people specialize in endometriosis or oncology, like if they had certain pelvic cancers. So there's so many different avenues you can go with pelvic floor therapy. Just my specialty is prenatal and postnatal.
Moms are now having babies in their late 30s, their early 40s, mid 40s, and it's a lot of stuff happening already during that time. On top of having a baby, going through pregnancy, and then postpartum. And I've heard from a few people that were over the age of 40, 42, who had babies, who were saying, now I'm going through the postpartum period and in perimenopause as well. And when you're breastfeeding, you learn that your hormone levels are at the same level they would be if you were in menopause when you're breastfeeding. And so that is new to people for them to be like, what is happening? Why am I having hot flashes? Why do I feel so lethargic? And so when you are treating clients, what have you seen with this uptick of moms to have their babies a little bit later? How are they transitioning? How are you helping them transition through the postpartum period as well as into this perimenopause period as well?
With this population, it's one of those you don't know what you don't know, because a lot of them don't even know that they about to encounter all this stuff.
Right.
Because they mama had them in their 20s, their grandmama had them in their 20s, and these are the people that are advising them on what to do. But in your 20s, you didn't have all this hormonal stuff going on. And I tell people the longer you wait to have kids, or even if I've had people that had their kid in their 20s and then they had another kid in their late 30s or 40s, and they're like, yeah, this pregnancy is different. I'm like, yes, because you are super far removed from high school gym class. What that means is a lot of people, a lot of us don't have a regular workout regimen. The last time they had a regular workout regimen was high school gym class because they was forced to do that. But if they weren't like an athlete, played sports or something like that, they typically don't have a routine. So think of those muscles that haven't worked out and been strengthened, and then you're going to put this super huge stress on the body of pregnancy. Yes, they're going to have sciatic pain. Yes, they're going to have hip pain and back pain and all that. And probably some had that before they were even pregnant. But they just weren't dealing with it because, you know, us, we got to go to work. We got things to do. My back hurt, but I got to, do what I got to do. But not knowing if your back hurt a little bit now, it's really going to hurt when you got a bowling ball sized baby attached to you, and that's on your back. So I try to educate as much as I can. Everybody in general should be working out, but especially like I'm in this phase right now. I'll be 35 at the end of this month. So I'm in that about to be geriatric, advanced maternal age. I hate that crap. That's another soapbox I'll get on another day. That arise track. It's just dumb. Because just because you older don't mean you more unhealthy.
Right.
It could, but I mean, there are people that are older that are healthier than younger people just because they eat better and they work out, and younger people, they could be very sedentary. So to put everyone in a box and say just because you're a certain age, you're going to have issues with pregnancy and all this stuff, that doesn't make sense. I'm like, everyone's lifestyle is different.
Right.
But I tell people, you got to prep for birth. If you know that you're trying to get pregnant, like I know probably next year, my son's 2, probably next year we're going to try to get pregnant again. I had to do IUI. I got PCOS. That's a whole different story. But I know, okay, let me get my back together. Let me get my hips strong as possible because I don't want to hurt when I'm pregnant. Because once you're pregnant, you got the relaxing. Now your joints and your muscles all loosey-goosey, and I'm kind of like fighting against the clock because as I'm trying to strengthen you, your hips and things are spreading and getting more loose.
Right.
So if I can get you before, if you're like, hey, I'm thinking about getting pregnant, great, let's work on these things now, because any past injury you had is going to come up when you're pregnant because now you're going to be 50, 60 pounds heavier. Some people just 20 or 10, they're blessed, but some people 50, 60 pounds heavier that you're putting on these joints. And for every pound that you gain, that's an extra 4 pounds of pressure on your joints. And so if you're not strong enough to deal with your own weight right now when you're hurting, you're definitely going to hurt in pregnancy. So I tell people, just because you're pregnant, it's a reason why you could be hurting, but doesn't give you an excuse. So I really don't like when practitioners tell people, they say, oh, my back hurts and stuff. But when you had a baby, your back won't hurt anymore. Sometimes they may have had that back pain beforehand. And I can see people while they're pregnant. A lot of people think they got to wait till afterwards. No, I can give you some techniques, some exercises, some stretches to do to help relieve some of the sciatic pain or round ligament pain, the pelvic pain, pubic symphysis pain. Like I can help relieve some of that now. We don't have to wait until after you have a baby. So I tell them, and then around 35, that's when we start to lose our strength too. So we're having babies at a time where our strength is naturally declining. Our estrogen is declining. Some of us are going into perimenopause. When you're breastfeeding, your estrogen is declining. So I tell people when they're postpartum and they're breastfeeding, be gentle with yourself because you have all these hormonal changes. You're not going to be able to build strength as quickly as you did before because you're going through these changes. So people don't know that. Right. And I can scream it from the rooftops, oh, my mama had a baby. Yeah, but they wasn't 42 having a baby though.
Right. And it makes a world of difference. It absolutely makes a world of difference. And I think it's something that needs to be discussed more, especially with more people having babies after 40. They really need to know it's different. And then having some type of routine while you're pregnant. And then, like you're saying, making sure that you have that supportive team, making sure you're seeing your pelvic floor therapist and everyone else who you've come together with, that massage therapist, that chiropractor, your mental health therapist, your OB, your midwife, whoever it is that's on your team. Again, it is why it's so important that you have a team approach to care. And I love what you said. You're not trying to be all the things. You're just trying to do what you do well and leave the other things that other people can do. Let them take that on. And we can come together and make sure that you have that full wrap around service, that full circle of support that you need from the beginning all the way until you may not need us as much, right?
Mm-hmm.
When you're pregnant. So I think that is something. And that the fact that you just gave for every 1 pound you gave, it's 4 pounds of pressure on your joints. I have to put that up somewhere.
Mm-hmm.
So what's on the horizon for Dr. Lily?
On the horizon.
What's coming? What are you working on?
I've been posting more on TikTok, Instagram. Follow me at Dr. Lily. I've been trying to do more YouTube stuff, posting more content on there, trying to get more clients. This weekend, I'll be at a maternity fashion show. I have a booth there. Yeah, they need to know about pelvic floor therapy, so I'll be there. There was a yoga studio opening the week before that. I had a booth there. So anywhere I can get in front of people to say, hey, this is what I do. Come see me. I have some workshops planned, some pelvic floor and core workshops at a women's only gym coming up. I got 2 yoga studios in September and October. I'm doing workshops there. So I'm just trying to get in front of people, get my clientele up, do my birth ready stuff. But I like being an entrepreneur. It's hard work because I'm like 5 jobs in one, but I love it. So that's what's coming up.
Okay. Well, before we close out, there are usually 2 questions that I like to ask the guests. The first one is, how can we love on you? Where can people find you on social media? I'll also tag all of your information in the description of this episode as well. But if you just want to shout out your socials or anything else that you would like to share, please do.
To find me on Instagram and YouTube, I'm at Dr. Lily. TikTok was hating on me. I couldn't get the at Dr. Lily. It's at Dr._Lily on TikTok. So definitely if you can share the information, I always, even like different birth workers, I have free handouts that they can get to their clients as far as birth plans, hospital packing lists. All this stuff is free on my Stand store that you can access through my TikTok. My website is www.mamastayWellness.com. So if you want to know more about what I do, or if you want to book a free consultation with me, you can go there. I tell people, if you know anybody, even if it's your mom that's been leaking since 95, tell her she can come see me. Even though I specialize in prenatal and postnatal, I can see anybody. It's a pelvic floor. I can see you.
Yeah.
Now, of course, if it gets like the specialty areas like the oncology, stuff like that, I have people that I refer them out because I know that's their thing.
Right.
But if it's just, I got incontinence, pain with intercourse, I can see them even if they're not pregnant or in that postpartum phase. I tell people to share the knowledge. Any birth workers, if your clients are not seeing a pelvic floor therapist, they can see me. I can see people virtually. I can coach them virtually so they don't have to be in my state. I would love to help them out. So if you know anybody pregnant, tell them you need to be seeing a pelvic floor therapist. They may say, I don't have anything wrong. You don't know you don't have nothing wrong until you find something wrong. You know, you go get a massage, and you don't think something hurting, they touch something, you're like, oh, I didn't know that was bothering me.
Right.
That's how the pelvic floor therapist, we don't know you have an issue till I tell you got an issue.
Right.
Physical therapy is a direct access in a lot of states, which means you don't have to have a script to do that. So specifically in Ohio, I don't know the specific rules for every state, but a lot of states do have direct access. People can come to me without a script. I just have to let their doctor know within either 10 visits or 30 days. If I haven't had any improvement or anything like that, I have to notify their doctor, hey, I've been seeing this patient. I don't keep up with all of that. So when I see them for the evaluation, I just go ahead and fax it to their doctor so they know I'm seeing your patient. This is what's going on. If there's, of course, something alarming that I feel like they need further testing, I'll get on the phone and I'll call their doctor to say, hey, I saw something. They think they need to do some labs or x-rays, whatever. So a lot of times people are waiting and saying, well, my doctor didn't refer me there, so I guess I don't need it. We got to advocate for ourselves, y'all. Like, you can ask, or you can just pick up the phone and call a pelvic floor therapist and say, I'm going. What's your schedule? I'm going. So I think a lot of times we put so much power in the medical field and not knowing you can ask for yourself. You can speak up for yourself. You don't have to wait to get an appointment to tell your doctor that your back hurts to then go to physical therapy. Like, there's so much time. We could get you in and have you better by the time you do all that.
Right.
So I just tell people, don't let stuff go. The longer you wait, the more it's going to hurt. It's going to the longer to fix. So don't say I'll get to it. I even come to people's houses. My postpartum patients, if they're in the area, I understand you have a 12-week-old baby. It's really hard to get out. I'll come to your house and see you. So I don't want them to have to, well, I got to wait and all this stuff. I got to babysit. I can see you virtually. I can come to your house. You can come to me. So, and there's other people in the area in the United States that do that as well.
Right.
So I just tell people, if you got issues, just come to us.
Yeah. I love that. And then the last question I ask everyone is, with all of your lived experiences, everything that you've seen, you felt in your life, what would you tell the little Dr. Lily?
Ooh. That boy don't love you. That got nothing to do with nothing. He got nothing to do with nothing. I was like, whoa, that would save me a lot of time and headache if somebody could have told me that. Which one? Several. That boy don't love you.
I don't think the advice gets any better than that. Like, period. Like, cut. We're done. You did it.
That boy don't love you.
I mean, I'm sure a lot of us can definitely be like, true.
Move on.
That would have saved me a lot of time.
Move on.
Just a lot of time.
Move on. That boy don't love you. You're not going to get married. Move on. You actually not even going to like this person in 6 months. You're actually not even going to speak to him. Like, stop doing that.
Oh my gosh, Dr. Lily. You're so funny.
On a serious note, I would say let God lead you. So that's, I was looking for the pivot and just see the opportunities, like doors will open that you don't even know. So try something new. A lot of times people say, oh, well, Black people don't do that, or, especially yoga and things like that. Just open your mind to things. You never know what you're going to like if you never tried it before. Just because you don't know nobody else that does it doesn't mean you're not going to like it.
Right.
So I always say, be willing to learn, because you never know what you are into. I could, little Lily wouldn't have been able to tell you I like pelvic floors.
Right.
I didn't even know what it was.
Right.
So just let God lead you, and his plan's better than yours. Even though I'd be like, I think mine's pretty good, but his plan's better than yours. And that boy don't love you. And that boy don't love you.
And that boy don't love you. I love it. Thank you, Dr. Lily, so much for being with us today. You have been just pure joy. We got a little bit of education. We got some laughs. We just had a time today, and I honor and appreciate you for all of the work that you're doing. Thank you for being here with me today, and thank you for sharing your story. Please go out and follow Dr. Lily on all of her social media. Please reach out to her to become a client, refer clients to her. Let's just show her lots of love and support. And like with every other guest that has been on the podcast, our goal is to share stories. Our goal is to share our journey, creating a safe and sacred space for us to talk, to laugh, to cry, and just to be in community with one another. So welcome to the community, Dr. Lily. It was a pleasure to have you. We would love to have you back again. Absolutely, to laugh with you and to learn more from you. But again, thank you everybody for joining today, and we will see you in the next episode. Peace.